ctev. The four components of ctev are ankle, ankle equinus, hindfoot varus, midfoot cavus, forefoot adduction. And the aim of treatment is to produce and maintain plantigrades functional foot. The primary treatment is conservative in ctev, and this conservative treatment starts within a day or two of the birth, which is the repeated manipulation and adhesive strapping with regular monitoring of correction by a physical therapist. Alternatively, what we can do is a light plaster cast is applied with correction of deformity, and that is changed every week. The order of correction is very important, and the mnemonic to remember the order of correction is cave, that is cavus, adductus, varus and equinus. Midfoot cavus, forefoot adduction, hindfoot varus and lastly ankle equinus. If there is incorrect manipulation, then complication arises which is called rocker bottom deformity, and this occurs due to attempts to overcome equinus before the other deformities are corrected, causing a break in the foot in mid-tarsal region. The universally accepted method used for serial manipulation and casting is Ponseti method. The previous method was kite technique, but it is not used nowadays. The Ponseti technique is differs from kite technique in that is the kite technique, the center of rotation of malaligned foot is on the cuboid, whereas in the Ponseti technique the fulcrum is on the head of talus. In Ponseti, head of talus. So there are resistant case. So in this resistant case we have to do surgeries. The surgery performed for ctev are persistent equinus deformity alone, that includes tendo-Achilles release in young infants and tendo-Achilles lengthening in older children. Release in young infants, lengthening in older children. All components remaining we can do posterior medial soft tissue release. The tendo-Achilles and tibialis posterior tendons are lengthened by Z tenotomy to correct equinus and varus respectively. The posterior capsules of ankle and soft talus joints are divided to correct equinus. The flexor digitorum longus and flexor hallucis longus are lengthened to correct the equinus. The calcaneofibular ligament released to correct calcaneal rotation. The talonavicular and calcaneocuboid joints released to correct forefoot adduction. The origin of intrinsic muscle and plantar fascia from the calcaneum divided to reduce any cavus or plantaris deformity. The foot is placed in a plaster cast in corrected position. In case of late or relapsed clubfoot, in case of a young child, we can do a revision of the soft tissue release or shortening of the lateral side of the foot by calcaneo-cuboid fusion or cuboid inoculation, that is Evans operation, to correct the forefoot adduction. Evans operation to correct the forefoot adduction. The calcaneal lateral closing wedge osteotomy to correct varus deformity. In older children, Elizarov fixator, and in above 12 years the triple arthrodesis. The triple arthrodesis consists of fusion of subtalar, talonavicular and calcaneocuboid joints after the correction of deformity.